Hi, I'm Kirsten and I'm going to be your nurse today. How are you?
Good, thanks. How are you?
I'm good. Please state your full name and date of birth.
Lorene Ryan, July 9th, 1968.
Okay, I'm just going to check your wristband. Okay, this is the correct patient. Today I'm going to be doing a focused assessment. It is going to take about 5 to 8 minutes. I'm going to explain myself as we go through. Please let me know if you have any questions or you are uncomfortable.
Thank
you. Okay, patient understands the purpose of the exam. Before we begin, please empty your bladder and put on this gown. And are you comfortable with this room in regards to warmth and privacy?
Yes, thank you.
Okay, patient is prepared for the exam and is comfortable with the room in regards to warmth and privacy. So I'm just going to ask you a couple of questions. So do you have a history of chronic illnesses such as diabetes, kidney failure, or high blood pressure?
No.
Have you experienced any chest pain, palpitations, anything like that?
No.
No? Okay. Have you experienced any swelling, pain, skin changes all in your legs, so such as like redness, visible veins, all of that?
No.
No? And do you have a family history of high blood pressure, cardiac disease, or diabetes?
No.
Okay, the patient has answered all of my questions that were needed. So now I'm just going to look at her overall appearance. So she is at ease and relaxed, and skin color is pink and appropriate for ethnicity. So now I'm just going to palpate your temporal pulses and your carotid pulses. So let me know if you're uncomfortable. Okay, temporal pulses are equal bilaterally and 2+. Carotid pulses are 2+ and equal. So now I am just going to inspect your arms. So the arms are symmetrical and proportional to the patient's body. The color is pink. There is also no edema. So now I'm just going to touch your arms with the back of my hands. Please let me know if you're uncomfortable. So I'm just going to touch here. Okay, patient's arms are pink and warm. So now I'm just going to pinch the top of your skin. Skin turgor is elastic and there's no tinting noted. So next I am just going to pinch your fingertips and check for capillary refill. Capillary refill is less than 3 seconds. And now I'm also just going to look at the angle, so just go like this if you could. Okay, nail beds are 160 degrees and the nails are pink. So next I am going to check for the pulses in multiple places in your arm. So I'm going to do the brachial pulse first, so if you just go like this. Okay, brachial pulses are 2+ and equal. Radial pulses are also 2+ and equal, and they are both normal and regular. So now I'm going to be performing the exact same assessment but on your legs. So first I'm just going to assess your legs. Legs are symmetrical and proportionate to the patient's body. There is no edema noted. Again, I'm going to check with the back of my hands. Please let me know if you're uncomfortable. I'm going to check here. Okay, patient's legs are pink and warm. So now I'm going to check for 2 pulses. So I'm going to check for your posterior tibialis pulse and also your dorsalis pedis pulse. I'm going to check here. Okay, that pulse is 2+ and regular. And the dorsalis pedis pulse is also 2+ and regular. And now I'm just going to be performing capillary refill again. Capillary refill is less than 3 seconds. So now I am going to be assessing your apical pulse. So your apical pulse is going to be in the 5th intercostal space in the left midclavicular line. So first I'm going to find it with my hands and then I'm going to listen to it. So here. Okay, now I'm going to listen to the apical pulse. Okay, apical pulse is 2+ and regular. So next I'm going to be listening to the carotid pulse. I'm just going to ask you to breathe in and hold your breath once I begin. Okay, please breathe in. Okay, there are no bruits present over the carotid artery. So next I'm going to be listening to heart sounds in all 5 places. First I'm going to be doing it with the diaphragm and then I will be performing it with the bell. But before I do that, I'm just going to inspect the chest. So the chest is symmetric and there is no abnormal pulsations. So now I will begin with the diaphragm. And then again with the bell. Okay, so my findings are that S2 is louder than S1 over the aortic and pulmonic valves. S2 and S1 are equal over Elb's point. S1 is louder than S2 over the mitral and tricuspid valves. Okay, that is the end of your assessment. Have a good day.
Thank you. You too.